Think is made possible in part by Del Perot Systems. Del Perot Systems develops and delivers a comprehensive suite of IT and application services, business process solutions, and consulting services designed to help customers succeed. For more information, you can visit Dell.com. By Southwest Securities, a nationally recognized regional brokerage firm that's been meeting the needs of Southwest investors for more than 30 years. Southwest Securities is a member of the New York Stock Exchange and SIPC. By the Executive Education Center at the University of Texas at Dallas, providing degree and non-degree programs to help corporate professionals and executives stay ahead. On the web at som.utdallas.edu/executive. And by the valued support of KERA members. Thank you.
Welcome to Think on KERA. I'm Chris Boyd. How will the new health laws change the lives of North Texans who couldn't afford care in the past? And will an influx of newly insured patients change the healthcare system overall? Ron Anderson is president and CEO of the Parkland Health and Hospital System. He's here to talk about how he and his colleagues are preparing for what's to come. Dr. Anderson, welcome back to Think.
Glad to be back, Chris.
One of the big changes here is that Medicaid will now be extended to people who make 133% of the federal poverty line. Given the fact that of the 15 largest U.S. cities, Dallas currently ranks dead last in the percentage of doctors who see Medicaid patients and accept them, who's going to care for these people?
Well, that's a real concern, and we always emphasize that coverage is not care. And in Texas today, only about 28-30% of the doctors will actually see a new Medicaid patient, and that's down from 38% a year or so back. So if you give them insurance, will the rates be sufficient to attract a private physician? In Massachusetts, that didn't happen. It was hard to get a doctor to see a patient. It took 14 weeks to see a primary care physician, and a subspecialty physician even longer, so the patients went back to the emergency room. And that's just the opposite of what we want, but that may be one of the unintended consequences. Texas has fewer doctors, by the way, than almost any other place. We're 46th or so in the nation on per capita numbers of doctors, so 192 doctors per 100,000 versus 252 nationally. So it's harder even here to get a medical home. So what happens maybe is people come back to the public hospital. They did that in Massachusetts, so much so that the public hospitals actually lost some of their money, their subsidies, to buy insurance, but the patients couldn't get in, so they came back to the public hospital. And the two big hospitals there actually suffered huge losses in the first year or so until it was realized what had happened. And so we're worried about whether or not we can access care for patients.
So what happens to your bottom line if a larger proportion of the people who walk through Parkland stores and through the clinic stores have at least Medicaid or some kind of private insurance who didn't have any coverage at all before?
Medicaid is a payer that pays maybe half of the real cost of care. And so you need something called disproportionate share adjustments or upper payment limit adjustments. You need some bump to your local taxes, a federal match to actually pay for it to break even. Private hospitals and others may not want to do that. Private doctors can't really do that. They don't have that money. And so it's a problem. And so your bottom line could be affected. However, 50% of our patients are charity patients now that pay nothing. So we've done some studies, and about 80% of the patients we care for are below 133% poverty. And if that's the case, then we have new payment sources. And one of our dreams would be that we could decrease local taxes by having some payer source, but we still think there'll have to be some local subsidy to make up for the poor payer that Medicaid is. Medicare is a better payer. One of the things in this bill that's really good is that Medicare rates may be paid for Medicaid work for doctors who are primary care doctors. They're trying to encourage the Obama administration, these physicians, to take patients. Meanwhile, they're also talking about cutting Medicare payment. And so, it's kind of one hand washes the other, so to speak, but not in this case. So it may be that the Medicaid becomes like Medicare, but Medicare gets worse. So we're not sure yet how that will play out.
The state of Texas has 1.4 estimated undocumented immigrants, about 40% of which have some kind of private coverage, according to some studies, but that leaves 840,000 with no coverage. You talk about 50% of the people who walk through your doors can't pay at all, and I would imagine at least a proportion of those are undocumented immigrants. There is nothing in this new law that covers them at all. So are you able to estimate what the real impact will be based on that?
The real impact of the undocumented now, a lot of it is they're young, they're workers, they come, and so childbearing is a big issue. Mm-hmm. And many of the undocumented we care for are childbearing women, the children of whom are going to be citizens. And so that's one issue. Medicaid Type 30, which is a program that pays for the delivery, doesn't pay for the prenatal care, actually is available to us now. So it's not as big a burden on local taxpayers as one might imagine. But injury to young workers, car crashes, all of the things that happen to young people, and sometimes catastrophic illness like cancer. Those are the things that really are high-cost situations, and we still care for those individuals. We're one of the places that cares for undocumented people in our clinics, and the reason is we don't want to see them come to the ER where in an emergency we have to render care, and the care would be 6 or 8 times more expensive than rendering the care in a primary care setting. So we've looked at this from an economic point of view as well as a humane point of view, and we've continued to care for them if they're residents of Dallas County and they're contributing to the local economy. One of the ironic situations that people don't realize, they always say that these people don't pay taxes, but they pay Medicare tax, they pay Social Security tax, they may pay sales tax and ad valorem taxes for their rental properties or whatever. So they do, but they oftentimes don't get benefit from that because they can't get Medicare benefits and they can't get Social Security benefits. So in a fashion, they pay taxes without receipt of benefit. Now, does it really cover their total cost of being here? That's a question that everybody will argue about, but it's not true that they don't pay taxes just like all of the people who live in Dallas County. So in some fashions, people who come from Collin County here for care are more of a burden than the undocumented. And in some ways, if you look at what the impact is on the economy, most people don't look at it that way, but that's one way at least to rationalize it, I suppose.
Clearly there are different primary roles and missions, but there is a certain symbiosis between the public health system and the private for-profit health system, particularly in caring for indigent patients. How do you think the private for-profit health industry might reorganize in relation to the new laws, and how do you think that'll affect its relationship with public health?
Well, first I'd like to say that the private, both for-profit and nonprofit hospitals in Dallas have been good partners with Parkland in general. They do a larger percentage of charity care than most hospitals in the United States. They're sister institutions. Why? Medicaid in Texas is very austere. And so a hospital like Baylor or Methodist hospitals really do a lot of charity care. And maybe they'll do less, maybe there'll be less cost shifting. They may or may not want these patients who are marginal payers, but I think that since they do charity care today, they'll continue to see some important portion of these patients as well. But to the degree that people are insured, we should stop the cost shifting that goes on in private hospitals. It goes on at Parkland for a lot of our business. We have to break even. And so you charge more for those that are insured than you would if you weren't caring for lots of people who were uninsured. And so I think that there's going to be a nice mitigation of the burden on private people who pay a hidden tax because of the uninsured. The current situation was untenable and I think unsustainable because of all the cost shift. In Texas, 1 in 4 people is uninsured. In Dallas, the city of Dallas, 1 in 3. And that's something that really no industry, whether it's for-profit, non-profit, or public, can sustain. And so I think we're all connected. There is a symbiosis. There's an ecology here. And if Parkland doesn't do its share, for example, it burdens then the private sector. And it runs down eventually to the employer paying higher premiums if too many people are uninsured. And sadly, in this reform bill, still 25 million people, and in Texas, at least 2 million people out of the 6 currently uninsured will continue to be uninsured because they're either undocumented or they work for small business or they're self-insured. There'll be a lot of incentives for people to get insured, but we still think there'll be a substantial number of folks that are not covered.
So realistically, will Texas still be at the bottom of the list in terms of coverage, do you think?
Texas has traditionally been right at the bottom. We're 46th in mental health, alcohol and substance abuse. Most everything we're in the bottom 40. And you wonder why. We're a state with the highest 26%, or the 26th highest per capita income, and 46th lowest in services. Why? We're a bootstrap place. We believe in people earning their own way. It's ironic because when you think about children, we'll cover children. But if we cover their parents, the children would actually be healthier. If we covered the parents, the children would actually miss less school. They'd be able to work. They'd be more productive. There's all kinds of reasons to cover the poor. But the biggest reason is to stop the cost shifting that goes on that really is making health insurance unaffordable for you and I. And so I think that there are some good things about this bill. I'm just sad that it only went to 32 million new Americans instead of going all the way and becoming universal. If it's universal, then you have a much better chance to control cost.
You mentioned at the top of the interview that coverage is not care. I want to talk about the sort of re-education that might be necessary for people who have not been in the habit because they didn't have the financial resources or just really didn't understand that it was possible to care for their health in a preventive way, to receive screening care and sort of primary care before things are really serious. Will we have to teach those people to go and seek that care at the appropriate times, or will we be sort of inundated right away?
Well, we'll be maybe inundated to the degree, if you're poor, you're not an overutilizer of health care. That's a misconception. The poor uninsured people use about 2/3 as much health care, and they wait late in the process. So they come in and they are more expensive at that point. But if they saw doctors as frequently as we recommend people see them, they'd see probably doctors a third more. So right there, just with the poor who already are covered with Medicaid and other things, we'd likely see an increase in utilization. More people will be covered and increase in utilization. Can we find homes for them? That's really important. But they're taking away the front-end copays for preventive things. I think that's a very good part of the bill, one of the most important parts of the bill. It happens even for Medicare patients. They're trying to take away the cost of getting preventive interventions. And I think that's critically important because people oftentimes, if there's a cost-sensitive situation, will not do the things that are very cost-beneficial, just like they won't do the things that are unnecessary and elective. So you may reduce cost, but you may reduce the wrong cost. And so there's going to be an encouragement in this reform to get the preventive benefit, to get the preventive services to patients. We've got to educate them of why they need to be involved in their care, why they need to hopefully help decrease demand by staying healthy. And we've got to empower them to actually learn how to do that for themselves.
If you put back a front-end copay, though, for Medicaid in particular, where there is such a lack of physicians able to cover all those patients, wouldn't more, if that money went directly to the physician, wouldn't more doctors consider caring for these patients?
There's been an argument for years about balanced billing, and if Medicaid doesn't cover my cost, can I bill them directly? It's a chilling effect on the poor. They're very, very price sensitive. But the other situation that oftentimes occurs is you put the barriers in the wrong place, and what we need is a fair reimbursement for Medicaid and take the barriers down for the individual patient. Most people do studies show that copays in European countries that have copays don't really decrease utilization that much. They're modest, and so whatever copay you have, it should be modest. On the other hand, if it's a copay for misuse of the emergency room when you could have seen your primary care doctor, then I think that's something that we ought to consider. I mean, because there needs to be some reason for people to realize they have some skin in the game, if you will, and they need to be proper consumers. But I think anything that would actually impede utilization of the things we want them to get is probably, nickel wise, pound foolish.
Briefly, do you think that this law will cause a lot of Americans to take more personal responsibility for their health, or is that something that is unrelated to what we've just passed?
Well, the insurance system we had in the past actually separated us from the consequences of bad decisions. Somebody else paid for it. People wanted to use up their benefits before they had to pay new co-insurance and deductibles. At the end of the year, you'd see a lot of people pushing to get services done that were elective because they didn't want to end up having to pay more out of pocket and that sort of thing. They didn't really tie the consumption of these things to the overall cost because it wasn't their cost. It was their employer's cost or somebody else. I think we're all going to have to be more aware that these are finite resources, and we've got to start looking also not at volume of work, but value of work. And I hear this all the time from the Obama administration. I hear it from the AHA, which I'm a board member of. You know, we've got to change our whole thought process. And you don't make money by doing more. You make money by doing better.
Dr. Anderson, thank you so much. That's all the time we have. I really appreciate it.
Thank you.
Just ahead on Think, Jerome Weeks talks about saving the art of Iraq. First, check out this week's arts calendar.
The Art and Seat calendar for this weekend features A Salesman, Fair Park, and Ben Folds. Ben Folds performs at the House of Blues in Dallas. The folk rocker will play songs like Rockin' the Suburbs to piano. Head to Fair Park in Dallas for City Arts 2010. The festival features music, dance, performing arts, and activities for children. William Campbell Contemporary Art in Fort Worth shows James Blake's Drawings 2010. The exhibit contains drawings of nature and everyday life from the Texas artist. And Death of a Salesman continues at the Wiley Theater in Dallas. The Pulitzer Prize-winning play follows a traveling salesman with modest dreams. For these and other events, visit artandseek.org. For Art and Seek, I'm Nilofer Arsala.
I'm Jerome Weeks. In the rubble of a military invasion, how do you preserve ordinary life, and how do you preserve a country's art? Natasha Boot is a leading authority on modern Arab art. She's the director of the Contemporary Arab and Muslim Cultural Studies Institute at the University of North Texas. The institute is currently showing a photo exhibition in Denton called Open Shutters Iraq. Nada, welcome to Think.
Thank you.
Now, Open Shutters Iraq is not an ordinary photo exhibition in that women had to be trained to be photographers in Iraq. Could you explain?
Well, actually, it was a project that the London-based photographer Eugenie Dolberg initiated. She's been doing this kind of work in other zones of conflict places, and she wanted to do the same with Iraq. And she wanted to take, she had several funding from various NGOs and the UNESCO, and so she wanted to take women from Iraq, train them in photography, ran a workshop on photography, train them so they can actually then go and document their own life stories. The idea was to give a different sort of vision to what's happening in Iraq that is more intimate, more personal, more humane than media sort of larger conflict war. So ideally she wanted to go to Iraq and train the women there, except of course situations didn't allow, so she rented a house in Old City in Damascus, which actually kind of helped the whole procedure because it took the women out of their zone of conflict into a more comfortable zone where they could relax and they could actually bond. There were women from 5 different cities in Iraq, varied ethnic and religious backgrounds, some actually in conflict at the moment, and so it was really interesting to see them bond. And while this was happening, she was teaching them how to actually use the camera to their own advantage to document and to map out their life stories. It was all being documented by the also London-based film director Maysoon Pachachi, who actually ran an independent film school in Baghdad. She started it in 2004.
Now, I was expecting in Open Shutters Iraq images of personal loss, family trauma, that sort of thing, and of course there is some of that. But I was struck by the story of Raya about the loss of a street, a kind of vital part of city culture. Could you talk about that? Well,
actually, that is a loss that it has affected many Iraqis on various levels, particularly intellectuals and artists. Meetingonymy Street, this is a bookseller street historically through the Ottoman ages, and in fact there are the Ottoman buildings of government were there, but also the cafes where all the artists hung out and exchanged ideas throughout the modern history of Iraq. And there was a car bombing, and the whole street was actually destroyed. And because actually, when I was in Baghdad, for instance, in 2003, and went to the Meetingonymy Street, because of no electricity and heat. So mostly the books were outside on the street as opposed to inside. I mean, they had stuff in the store, but it was really difficult to go and just kind of, go through the books. So they actually had samplings, or, what they deemed more important, on the street itself. So all of that, there was just sort of a bloodbath of books everywhere, as well as people, of course. Yes. Yeah.
Well, considering Open Shutters Iraq, it's a little ironic that your own book, Modern Arab Art, doesn't deal with photography much.
Yeah.
What is the status of photography as an art in the Arab world?
Well, yeah, of course, the Arab world is a very large place, right? So, it's not the same, it's not equal everywhere. But, I mean, it developed as well as it developed everywhere else, but because, for instance, in Iraq, the fact that, photography requires equipment, and particularly as technology progresses, that means more expensive equipment that were not available in Iraq, particularly during the 90s with sanctions. And so they had cameras, there is photography, there is tradition of photography in Iraq, throughout the 20th century, but as an art form didn't develop much because, as in relation to painting, for instance, and sculpture, because of lack of the equipment as it was getting, sort of more advanced. But the irony is, after 2003, there's a lot of film and photography that is coming out of Iraq because all of a sudden the equipment are available, technology is available as well.
Another major project of yours has been documenting the 8,000 artworks that were lost from the Modern Art Museum in Baghdad. This isn't the National Museum, which housed the antiquities. Right. You're not necessarily trying to recover these artworks, just simply catalog them. Why?
I gave up on trying to recover because I tried initially trying to recover them, but there was a very short window of opportunity. In June 2003, when I was in Baghdad, I was told by someone, actually, if I had $50,000 in cash, I could have probably retrieved a lot of those works.
They were looted, and they were still in the city.
Many of them were still in the city. I mean, the conspiracy theory goes, a lot of it is really true, but this had happened in all the museums, that key works were smuggled out actually at the eve of invasion. So by, inside job, by some sort of, collaboration, same as that happened at the National Museum. But then 2 days after the invasion, actually, when I was there, for instance, I was told that it was bombed and burned. Well, it wasn't bombed, but it was burned and it was looted. And so they smashed a lot of sculpture, cut a lot of painting. Sometimes they took the wood as opposed to the canvas, and sometimes they just used it for utilitarian parts. But the key works, left. And in fact, now, a year later, it used to be that someone would sell you a truckload of work for $4,000, for instance, that, is in somewhere, or, some masterpieces were actually found in the flea market around Baghdad. But a year and two after that, they understood the power of it, the value of it, particularly as, you started seeing some of these works by famous artists like Jawad Salim, Shakir Hassan at Christie's and Sotheby's, and so all of a sudden the value goes up, and so then they were also smuggled out. So I see them. I see them in Jordan, I see them in London, I see them here in the U.S., but there's not much to do. So I have to revert to documenting, because actually you can't do anything, even to stop the trafficking of it, unless you have a way of proving that these were the property of the museum.
So the museum, the museum had no catalog, or it was lost?
It was lost. So there was an archive, but we're talking old school archive. So this is not something, completely full with images and everything, but rather a lot of, receipts, which is great. It proves provenance. So that would have been very useful. But that disappeared and only surfaced 2 or 3 years ago. So now I'm very suspicious even of it, because with the trafficking, with the looting, with the forgery, there's a big mess to sort out things. So trying to document as much as possible, because realistically there's just no way I can document the 7,000 to 8,000. Actually, no one really knows exactly how many, so there is that problem, because I've heard various numbers. So that becomes one of the difficulties of trying to at least even document that. But it's very important to document them, yes, because it can become a document for authorities to stop looting, but also for research, for scholars to be working on modern Iraqi art, which is something that is not available at the moment.
Quickly now, how are you able to do this outside the country?
Yeah, well, there are not many artists inside of the country anymore, so many were in Amman, Jordan for a while, so I made that my base of operation, but now they're everywhere. A bunch of them are here in Texas, actually, Iraqi artists, and so I'm based on their memory. I was able to actually find the photographer of the center and bought some hard copies from her, but also found some CDs that were filmed in there. So it's a lot of tedious work, but publications of the Ministry and of Culture and of the museum from the 80s and 70s at least tells me, because these were the official work from the Iraqi government, so they at least tell me that those were the works that were in the museum for fact. But there is always going to be a doubt, that these are probably works from the museum. I can't prove 100%, except for the artists who are still living who can tell me, yes, those are my works that were in the museum.
You planning to put this catalog online?
Yes, actually, we had an NEH grant, and it's a collaborative work between the University of North Texas and Alexandria Archive Institute in Berkeley, and it is Modern Art Iraq Archive, so where it will be released in August.
Thank you very much, and good luck with the exhibition.
Thank you.
To see images from Open Shutters Iraq and the Lost Art of Baghdad, go to artandseek.org. Chris?
Thanks, Jerome. To access our free podcast, you can go to the Think page of KERA's website, kera.org/think. And we'd like to know your thoughts on the show as well. You can email us at think@kera.org. My name is Chris Boyd. Thanks for being with us, and have a great week.
To learn more, go to kera.org/think. Think is made possible in part by Del Perot Systems. Del Perot Systems develops and delivers a comprehensive suite of IT and application services, business process solutions, and consulting services designed to help customers succeed. For more information, you can visit Dell.com. By Southwest Securities, a nationally recognized regional brokerage firm that's been meeting the needs of Southwest investors for more than 30 years. Southwest Securities is a member of the New York Stock Exchange and SIPC. By the Executive Education Center at the University of Texas at Dallas, providing degree and non-degree programs to help corporate professionals and executives stay ahead. On the web at som.utdallas.edu/executive. And by the valued support of KERA members. Thank you.